Welcome to my presentation on antibacterial drugs. So I'm going to start off with cephalosporins, and I know that in the beta-lactam class of drugs there are more than just cephalosporins. There are the penicillins, but those are pretty easy to remember. And so I'm going to start off talking about cephalosporins, which, as I mentioned, are a beta-lactam group of drugs. They inhibit cell wall synthesis, and they are bactericidal, which means that they can kill bacteria. There are 4 classes, and every cephalosporin begins with a ceph. It may be spelled CEF or it may be spelled CEPH. And I want you to pay attention to names when figuring out class. So for example, for the first generation, you're going to have an A after the ceph. Cefazolin, cephalexin. And they affect gram-positives and major intestinal pathogens, such as Proteus, E. coli, and Klebsiella. The second generation has an O or a U after the ceph. Cefoxitin, cefaclor, and cefuroxime. Everything in the first generation coverage is also in the second generation coverage, but in addition you have Haemophilus influenza, Neisseria, and Enterobacter that are covered by second generation. Third generation has an increased gram-negative coverage, and you can recognize third generation drugs by the O-Tax, Triax, and Taz after the ceph. So you got cefotaxime, ceftriaxone, and ceftazidime. Fourth generation, remember cefepime, and it affects Pseudomonas, so it's the only cephalosporin that can be used on Pseudomonas. And as for Astrionam, it's a monobactam that works on the cell wall and prevents cross-linking of peptidoglycan. It's used on gram-negative rods, and it's resistant to beta-lactamases. Carbapenems are imipenem and meropenem. They have a wide spectrum, but they're used only in severe life-threatening infections. Imipenem is always used with celastatin, and celastatin is basically a dehydropeptase 1 inhibitor in the renal tubules of the kidney, so it prevents the imipenem from being deactivated in the renal tubules. At high plasma levels, carbapenems cause seizures, and they can also cause GI distress and rash. Vancomycin is another cell wall inhibitor. It binds D-ala-ala of cell wall precursors. It's used on MRSA and C. difficile. It causes a ton of flushing, and when I say a ton of flushing, the TON stands for thrombophlebitis, ototoxicity, nephrotoxicity, and the flushing is red man syndrome. So, red man syndrome is just something that can be prevented by treating the patient with antihistamines and slow infusion of the drug. So resistance can occur. Aminoglycoside, they end in mycin, but so do the macrolides. So a way for you to remember aminoglycosides are gentle, new, amiable for gentamicin, amikacin, and neomycin. For tobramycin and streptomycin, I don't really have any effective way to remember them. Just try and remember them. They're a major bactericidal ribosomal inhibitor. So all of the ribosomal inhibitors, except for aminoglycoside, are bacteriostatic, which means they do not kill the bacteria. They're toxic to the kidneys, ears, nervous system, and they are teratogenic. Tetracycline is a 30S ribosomal inhibitor. It's there's a drug called Macrolides, which I remember by thinking demo, which is like a tryout. So it can be tried as a non-antibiotic in SIADH. Remember that doxycycline is not eliminated through kidneys. And the major side effect of tetracycline is tetracycline teeth, which can be caused by any tetracycline, but it's basically a discoloration of teeth that's severe. Macrolides. Macrolides are azithro, chlorithro, and erythromycin. They inhibit the translocation through 23S binding site of the 30S ribosome. The major clinical uses include atypical pneumonias and STDs. The side effects are prolonged QT interval and acute cholestatic hepatitis. Chloramphenicol is a 50S inhibitor, so we've gone over 30S inhibitors so far, and it inhibits the 50S ribosome by inhibiting the peptidyl transferase on the ribosome. It has a limited clinical use. It's mainly used in meningitis, but because of the side effect profile, it's not used very often. You see it more in developing countries. The two major side effects to remember would be aplastic anemia and gray baby syndrome. Clindamycin is another 50S ribosomal blocker, and it blocks 50S ribosome by blocking the transpeptidase. It's commonly used in lung abscesses and aspiration pneumonia. It can most famously cause pseudomembranous colitis because it changes the intestinal flora. It inhibits the flora to a point where Clostridium difficile overgrows. Sulfonamides are basically para-aminobenzoic antimetabolites. So they act or they mimic the PABA, and they act on dihydrotaurate synthase to inhibit it. They're commonly used for UTI and sometimes used for chlamydia. The side effect profile includes nephrotoxicity, photosensitivity, and kernicterus. Trimethoprim is used with SMX and is an example of sequential blockade. The combination with sulfonamides commonly used in UTI and pneumocystis cerevisiae. Side effects due to depletion of folic acid and scarcity of cell lines are due to this. So I've shown here that the previous drug discussed, the sulfonamides, blocks dihydrotaurate synthase, and this drug inhibits dihydrofolate reductase. So see in this diagram, it shows a sequential blockade. Fluoroquinolones, basically, they inhibit topoisomerase 2 and 4, and the names of these drugs end in floxacins, except for nalidixic acid, which is technically a quinolone. They're bactericidal, and they're used in genitourinary infections. Side effects include headache and dizziness, which are common, also tendon rupture, prolonged QT interval, and they're teratogenic. So something I've come up with to remember this is stay on top of the tendon, top meaning topoisomerase. And last but definitely not least is metronidazole. Its mechanism of action is it creates free radicals that damage DNA. It treats a variety of bacteria and protozoans. And by protozoans that it treats, I mean Giardia, Entamoeba, and Trichomonas. As for bacteria, it's used on G. vaginalis, Bacteroides, C. difficile, and it's also part of the triple or sometimes quadruple therapy for H. pylori. And a way to remember the main side effect, which is the disulfiram effect, is that alcohol doesn't mix with dazole, meaning metronidazole. The end. Please subscribe to my channel.